India enters day 9 of the lockdown. As per the Johns Hopkins University of Medicine, the total number of confirmed cases of COVID 19 so far are 9,37,783, of which 47,273 people have been declared dead. In India, the figure stands at 2,032 confirmed cases with 58 deaths. And at the midst of this tragedy, doctors in Indore today were beaten up for the crime of collecting samples. My name is Partha, and you're watching the very first episode of The Partha Show. My fellow citizens, it's time we had this conversation. We are at war. This is World War III. And at this time, the enemy we fight is invisible to the naked eye, a virus. Now, am I overstating this? Absolutely not. By the end of this pandemic, more Indians could be dead than in all the wars that we have fought as an independent country combined. Now, think about that. What's also different are the people who are fighting this war for us on the front lines. This time, it's not the soldiers, who I have a great deal of respect for, but this time, it's the men and women in white, our healthcare professionals, the doctors, the nurses, the non-medical staff in the hospitals. And in the midst of all this has come out a disturbing report that doctors in Indore were beaten up while they were trying to collect samples of COVID-19 suspects. Now, a report by the Times of India states the following, and I quote, "In an unfortunate incident, a team of doctors that had gone to collect samples of possible suspects of COVID-19 were attacked by a group of people in Indore, MP. Later on, the samples were collected in the presence of police personnel. Locals in Indore started pelting stones at them, at the team of doctors, and also abused them. After the intervention of the MP police, the doctors managed to collect the samples. An FIR has been registered in this case." Now, this is disturbing on many levels. Of course, this has not been the first case of violence against doctors. There have been a lot of every other month you hear cases. This is not the exception but a norm. It's become a norm in our culture nowadays. And the most famous case was on 11 June 2019 when the relatives of a 75-year-old patient hurled a brick at the head of a junior resident doctor at the NRS hospital in West Bengal. The doctor suffered from a skull fracture and required ICU admission. Now, as you remember, that this led to a massive strike of doctors, not just in West Bengal, but all over the country. But this happens all the time. And I could just go on and on with the number of examples of violence against doctors. But look, attacking doctors under any circumstances is not cool. In fact, attacking anybody in civil society physically under any circumstance is not cool. But at a time like this, when we are in the midst of a war, it's particularly disgusting. Now, look, doctors right now, or healthcare professionals in general, doctors, nurses, the people, the administrative staff at hospital, they are not just our frontline warriors in this war, but they are also the ones who are most disproportionately affected. In Italy, those hospitalized by COVID-19, 9% of them are healthcare professionals. Let me read you the latest numbers according to the Italian press. And I quote, "Latest figures in Italy show that of the 41,000 COVID-19 cases which are confirmed, 15,000 people have been hospitalized because of the severity of the symptoms. Of this, at least 2,609 are healthcare workers. In Spain, unconfirmed reports suggest that up to 30% of those infected are healthcare professionals. Now, I'm not sure how far that's true, but it's a scary number. Now, healthcare professionals all over the world, look, they are the ones who are most at risk. They are not just the ones who are fighting the war, but they are the ones who are most likely to die from this. Now, in India, we have a shortage of PPE as in personal protective equipment. By that, I mean your gloves, your gowns, or forget about hazmat suits, your masks. And by masks, I don't mean the normal masks, which don't do much. The N95 mask is probably the only mask which right now can prevent you from breathing in the virus. And there have been reports in my home state of Bangalore of people using helmets and raincoats, which really don't do much for them, to be honest. But it's better than nothing. They're putting their lives at stake, And you have to remember that these people are not just doctors. They have families. They're human beings. They go home, and when they go home, suppose they're infected, they can infect their diabetic father or their asthmatic mother, and in those cases, that could be fatal. That could kill them. Now, I also wanted to speak about nurses in particular because they're also equally, or rather far more important, or at least more important. Reminds me of my med school days when my roommate, his mother was I think the head nurse at Victoria Hospital in Bangalore, and she was the motivation for him to go on to become a doctor and then to serve in the army. God bless her. Uh, Look, nurses in our country are criminally underpaid, all right, and they have to do a lot of menial jobs, like try not to vomit, but before a hernia operation, they have to shave the pubic hair of a patient. Now, how many of us would actually do that for the kind of salaries which they get? Now, think about that. But yet, in pop culture, nurses are depicted, in a very sexist, scandalous way. Look, I am not one of those left wing, politically correct liberals who make a big deal about everything. In my opinion, look, if a girl or a woman is beautiful, it's okay to say that they are beautiful, but not the kind of sexual innuendos which we see, on cinema, on TV serials, on cinema, on in movies, in general life. You know what I'm talking about. Bro, I am admitted in the hospital, bro. The Mallu nurse, no, the Mallu nurse is so hot, oh, today night I'll pakka try. Yeah, let's face it, some of you have done this, or you know somebody who's done this, or you have laughed at jokes like this on TV or in the movies. Look, and if you haven't done it, good for you, man. Good for you. But we have to say this, nurses and brothers, we call male nurses in India at least as brothers. Nurses and brothers are like angels of God on earth. They are the ones who are in this fight too. They're like how fighting alongside doctors, like how parents protect their children. Doing stuff which most people won't do. Now, if you consider yourself as a patriotic Indian, the next time you see people misbehaving with healthcare professionals, our heroes, stand up for them. Be their bodyguard, because especially now, as they fight for our lives, they need our support. They're fighting for our lives. They're putting their own lives in risk. They're putting the lives of their loved ones at risk, and we need to stand up for them. And lastly, let's also honor our prime minister's call to arms in trying to win this war. Stay at home and break the chain. Remember, there are people out there right now who are fighting for us, fighting this battle for us, putting their lives in danger. The least we can do, other than supporting them at this point of time, is to stay at home and break the chain. Be a responsible citizen. Be a responsible Indian. If you like the content of the show, please do like, share, and subscribe. And thank you for watching. Jai Hind.